Hey everyone, welcome to this one short lecture of respiratory system. तो सबसे पहले हम बैक्टीरियल इन्फेक्शन से स्टार्ट करेंगे. एंड फर्स्ट इज स्ट्रेप्टोकोकल फेरेंजाइटिस विच इज कॉज्ड बाय स्ट्रेप्टोकोकस पायोजेन्स ग्रुप ए. सो क्लिनिकल फीचर्स क्या क्या देखने को मिलेंगे. इरिदिमा, फेरेंजाइटिस है तो फेरिंग्स की स्वेलिंग, प्यूरुलेंट एक्सुडेट फॉर्मेशन, फीवर, मेलेस एंड लिम्फोडेनोपैथी. एंड कॉम्प्लिकेशंस कैन बी सुपोरेटिव एंड non-suppurative. Non-suppurative can be ARF, acute rheumatic fever, and PSGN. Suppurative complication can be quinsy, retropharyngeal abscess, pneumonia, empyema, bacteremia, or meningitis. And it can also cause scarlet fever, which is caused by streptococcal pyrogenic exotoxin A, B, and C. So it can cause pharyngitis, rashes, and strawberry tongue and pastia lines. लैब डायग्नोसिस में हमें पिन पॉइंट कॉलोनीज दिखेंगी एंड बीटा हीमोलिसिस दिखेगा ब्लड अगार पे. ट्रीटमेंट फॉर फेरेंजाइटिस इज बेंजाथीन, पीजी और पीवी. नेक्स्ट इज डिप्थेरिया विच इज कॉज्ड बाय कॉर्निबैक्टीरियम डिप्थेरिये. इट प्रोड्यूसेस डिप्थेरिया टॉक्सिन. इट इज़ ग्राम पॉजिटिव और 3N से हम इसे याद रख सकते हैं विच इज़ नॉन कैप्सुलेटेड, नॉन स्पोरिंग एंड नॉन मोटाइल. सो देर इज क्लब शेप स्वेलिंग एंड इट विल शो चाइनीज लेटर और क्यूनिफॉर्म अरेंजमेंट. स्नैपिंग टाइप ऑफ डिवीजन, मेटाक्रोमैटिक ग्रेन्यूल्स विजिबल होंगे, क्लेब्सलोफर बेसिलिस एंड डिप्थेरिया टॉक्सिन हैज 2 फ्रेगमेंट A and B. सो इट कैन कॉज रेस्पिरेटरी डिप्थेरिया विच इज फॉशियल डिप्थेरिया. तो इसमें क्या दिखेगा, टफ लेदरी ग्रेइश वाइट स्यूडो मेम्ब्रेन कोट, एयरवे ऑब्स्ट्रक्शन एंड बुल नेक अपीयरेंस. देन कुटेनियस डिप्थेरिया विच विल फॉर्म स्यूडो मेम्ब्रेन फॉर्मेशन एंड सिस्टमिक कॉम्प्लिकेशन लाइक मायोकार्डाइटिस एंड न्यूरोलॉजिकल कॉम्प्लिकेशंस. एंड ऑन पोटेशियम टेल्यूराइट अगर it will produce black colored colonies. So next is pneumococcal pneumonia or streptococcus pneumonia. It can cause lobar pneumonia, otitis media, sinusitis and meningitis. So there will be lanceolate shaped diplococci, gram positive bacteria. ऑप्टोगिन सेंसिटिविटी शो करेगा, बाइल सॉल्युबिलिटी शो करेगा, पॉलीसेक्राइड कैप्सूल होगा इसका. एंड विरुलेंस फैक्टर्स आर कैप्सुलर पॉलीसेक्राइड, C carbohydrate antigen, pneumolysine and autolysin. On blood agar it will show alpha hemolysis and Drotman or carom coin shape colonies. On chocolate agar there will be greenish discoloration or bleaching effect. Pneumonia के लिए amoxicillin and penicillin, meningitis vancomycin, ceftriaxone and for otitis media amoxicillin. And vaccines दो अवेलेबल है, PPSV23 and PCV1, 3 और 13. Next is Haemophilus influenza which is oxidase positive, gram negative bacilli, capsulated and pleomorphic, need special factor which are present in the blood like factor X and factor 5. So it can cause pneumonia and meningitis, whereas Haemophilus aegypticus can cause rashes and conjunctivitis. Hemolyticus and parahemolyticus are commensals of throat and mouth, normal flora. Haemophilus ducreyi can cause STD which is chancroid. And these three, Haemophilus aprophilus, paraprophilus and parainfluenza can cause infective endocarditis. And this is also called Fifus bacillus. Virulence factors are bacterial endotoxin, outer membrane protein, IgA1 protease, pili and adhesion protein. Serotyping is HIB and HIB capsule. Features it will show for CNS meningitis, epiglottis can be obstruction in the airway. It can also cause CAP, community acquired pneumonia, sinusitis and otitis media. So next is staphylococcal pneumonia which is caused by Staphylococcus aureus. It can cause infant pneumonia in infants and newborns. X-ray will reveal shaggy thin walled cavity which are pneumatocoel. Complications are pneumothorax, empyema. It can cause VAP in adults. Post-viral cap and CAMR SA. For Klebsiella pneumonia, it will colonize in oropharynx of hospitalized patients. So hospitalized acquired pneumonia is from Klebsiella pneumonia. There will be thick mucoid, brick red sputum, hypervirulent stain which can cause liver abscess and metastasize to eye, lung, CNS and hypermucoid. So they are short, plump, straight, capsulated gram-negative rod and large dome-shaped mucoid, sticky, pink-colored lactose fermenting colonies. Treatment as carbapenem. Now pneumonia plague is caused by Yersinia pestis by inhalation of bacilli in droplet expelled from another person or animal in plague pneumonia. It can show symptoms like cough, hemoptysis, dyspnea, chest pain and headache, and it is agent of bioterrorism. Treatment is gentamicin or streptomycin. So legionellosis is caused by Legionella pneumophila. It is also called Legionnaire's disease or interstitial pneumonia. It is transmitted by aspiration, aerosol from contaminated AC, nebulizer or humidifiers. There will be direct instillation into lung और man to man transmission नहीं होगा. Clinical feature, it will show pontine fever like acute flu-like illness, malaise, fever and headache. Pneumonia, X-ray will show pulmonary infiltrate, faint pleomorphic gram-negative rod or cocobacillus and neutrophil will be seen but organism नहीं दिखेगा. Pathogenesis is that it will reach lungs. Then alveolar macrophage will engulf them, which is coiling phagocytosis, and it will inhibit the phagolysosome formation. Treatment is azithromycin. So next is Mycoplasma pneumonia, which is called Eatonry agent or PPLO, pleuropneumonia like organism. It is the smallest microbe जिसकी कोई cell wall नहीं है. L form से show करेगा. It is attached to respiratory mucosa जिसकी वजह से injury हो जाएगी. There will be fried egg colonies on solid medium containing PPLO agar. There will be turbidity and color change in liquid medium containing PPLO agar. So solid में fried egg colony दिखेगी and liquid में turbidity and color change मिलेगा. These are mainly gram negative and pleomorphic, also called walking pneumonia. So clinical features में it will cause pharyngitis, tracheobronchitis, wheeze, dry cough, peribronchial pneumonia, cardiac features like pericarditis, myocarditis, reactive arthritis, anemia, hypercoagulopathy, encephalitis, aseptic meningitis and SJS, Stevens-Johnson syndrome. Treatment is macrolide like azithromycin. Next is chlamydia pneumonia जिसमें mainly 3 species involved है. Chlamydia pneumonia, Chlamydia psittaci and Chlamydia trachomatis. So psittacosis is caused by Chlamydia psittaci. It is a pathogen of parrots and psittacif birds. Pet birds and poultry are natural reservoirs and it is transmitted by inhalation of aerosol from avian nasal discharge. मतलब उनके nasal discharge से aerosol में की फॉर्म में स्प्रेड होगा जिसको हम इनहेल करेंगे. And also from fecal and feather dust. There will be mild influenza-like syndrome to interstitial pneumonia, septicemia and typhoid-like syndrome. Treatment is tetracycline. Now chlamydia pneumonia का भी treatment tetracycline है and it will cause atherosclerosis, atypical pneumonia, sinusitis, pharyngitis, asthma and COPD. And chlamydia trachomatis is spread from conjunctiva to pharynx via nasolacrimal duct. It can also cause otitis media and infant pneumonia. Treatment is erythromycin. Next is Pseudomonas, which is non-fermenting, oxidase positive, pigment producing gram negative bacilli. It will show fruity odor. It is opaque, irregular colony with metallic sheen and blue-green diffusible pigment of nutrient agar, beta hemolytic grey moist colony on blood agar. Clinical features will be HI, hospital acquired infection, bronchiectasis, cystic fibrosis, Shanghai fever, malignant otitis externa, bacteremia, infective endocarditis, swimmer ear, burn wound infection, and osteomyelitis. Pathogenesis is that first there will be colonization, then toxin mediated immune invasion, टिश्यू इंजरी एंड 2 तरह के टॉक्सिन होंगे, डिफ्यूजिबल एंड नॉन डिफ्यूजिबल. पिगमेंट 4 तरह के होंगे, पायोसायानिन, फ्लोरिसिनिन, पायोरुबिन एंड पायोमेलानिन. एंड ट्रीटमेंट इज पेनिसिलिन, कार्बापेनेम, एजिट्रियोनाम. नेक्स्ट इज वूपिंग कफ which is also called pertussis caused by Bordetella pertussis. Virulence factors are tracheal cytotoxin, pertussis toxin, adhesion like Fimbria, FHA and protectin. So first it is attached to ciliated epithelial cell, वहाँ पे वो मल्टीप्लाई होगा और टॉक्सिन प्रोड्यूस करेगा. सो एपिथेलियल सेल पे मल्टीप्लाई होकर टॉक्सिन प्रोड्यूस करेगा एंड म्यूकोजल डैमेज कर देगा एंड इट विल इम्पेयर होस्ट डिफेंस मैकेनिज्म. 3 स्टेजेस होंगी इसकी, कैटरल फेज, पैरोक्सिमल फेज एंड कन्वल्सेंट स्टेज. सो कैटरल फेज में कोल्ड, कोरिजा, फीवर, कफ एंड लैक्राइमेशन. पैरोक्सिमल फेज में वूपिंग कफ एंड पोस्ट ट्यूसिन वोमिटिंग. Convulsion stage में we have frequency and severity of cough will be decreased and antibody will appear in the serum. They are gram-negative cocobacilli and will show thumbprint appearance and mercury drop appearance or Reagan-Lowe agar. Treatment is azithromycin or 2 vaccines are whole cell pertussis vaccine and acellular pertussis vaccine. So next is paragoniasis, which is oriental lung fluke or endemic hemoptysis. So it is caused by Paragoniasis westermani, which is a trematode. Definite host is man and intermediate host सबसे पहला है snail and second is crab or crayfish. So life cycle इसका simple है. Larva intestinal wall में जाएगा. From there it will go to lungs, transform into adult worm, then fertilization and egg will pass into feces or sputum. Infective form is Metacercaria larva, which is oval golden brown operculated eggs. Clinical feature it will show is eosinophilic granulomatosis, inflammation, cough, brownish body, tinged, rusty sputum or fishy odor. Treatment is praziquantel. Next is pneumocystitis pneumonia, which is also called plasma cell pneumonia. It is a fungal infection but exists in cyst and trophozoite form caused by pneumocystis gyrovasii. Pathogenesis is that we will inhale the cyst, it will go to lung, then change to trophozoite stage, inflammatory response generate होगा, plasma cells and frothy exudate will fill the alveoli. We can perform bronchoscopy, open lung biopsy or bronchoalveolar lavage, which is BAL, and it will reveal the cyst. There will be crushed ping pong balls, again green background and GMS staining, ground glass opacity in chest x-ray and treatment is cotrimoxazole and इसके लिए कोई culture media नहीं होगा. Next is zygomycosis, which is also called mucormycosis. They are transmitted via inhalation, inoculation, ingestion of spores. So spores are mycelial form, aseptate hyphae, which can cause infection. It will show salt and pepper appearance in rhizopus, lid lifters on STA culture, and they are rhizoids, which are rhizopus, mucor and lycathemia. Predisposing factor are diabetic ketoacidosis, end-stage renal disease, iron therapy, deferoxamine, phagocyte function defect. Clinical features will show rhinocerebral mucormycosis for eye, facial pain, proptosis and vision loss. Pulmonary mucormycosis, dyspnea, cough, fever, chest pain, hemoptysis. Cutaneous mucormycosis, GIT का mucormycosis, disseminated and it may also affect bone, trachea and kidney. Treatment is amphotericin B deoxycholate. So next is aspergillosis, which is transmitted by inhalation of airborne conidia. Risk factors are glucocorticoid use, neutropenia, neutrophil dysfunction, underlying pneumonia, TB, COPD, sarcoidosis, and anti-tumor necrosis factor therapy. Clinical feature it will show is pulmonary aspergillosis, allergic bronchoscopy aspergillosis, severe bronchial asthma, aspergilloma, acute angioinvasive pulmonary aspergillosis, chronic cavity pulmonary aspergillosis, invasive sinusitis, cardiac cerebral, ocular और nail bed infection. 3 इसमें हमें स्पीशीज दिखेगी या 3 तरह की ये कॉलोनीज ही बनाएगा. एस्परजिलस फ्यूमिगेटस स्मोकी ग्रीन, G, Aspergillus flavus yellow green, and Niger will form black colonies. Treatment is voriconazole. Penicillosis, which is caused by Penicillium marnefi, invasive penicillosis करवाएगा ये, like endocarditis, endophthalmitis, superficial disease like otomycosis, keratitis, onychomycosis, and allergic disease like asthma and allergic pneumonitis. So there are flat with velvety to powdery texture, greenish in color, and brush border appearance in LPCB mount. Next is common cold, which is a rhinoviral infection or also called rhinosinusitis. It uses intracellular adhesion molecular 1 as receptor and resemble enterovirus in structure and property, except that acid labilin transmitted by respiratory route. So there can be common cold syndrome, sneezing, nasal obstruction, discharge, sore throat, otitis media, sinusitis, bronchitis and pneumonitis, but fever नहीं होगा. Cold में fever नहीं होगा. Treatment is symptomatic treatment of all these signs and symptoms. Next is infectious mononucleosis, which is caused to Epstein-Barr virus, and it is glandular disease and also called kissing disease because salivary contact से ये ट्रांसमिट होगा. सो पैथोजेनेसिस इसका क्या है कि जो EBV है वो बीटा सेल के रिसेप्टर्स पे बाइंड कर जाएगा. कहाँ पे? फेरेंजियल एपिथेलियल सेल्स पे. वहाँ पे रिसेप्टर्स पे वो जाके रेप्लिकेट करेगा और बीटा सेल्स को इन्फेक्ट करेगा, जिस वजह से बीटा सेल इमोरलाइज्ड हो जाएंगे. IgG सिक्रीट्स होंगे, ऑटो एंटीबॉडीज एंड CD8+ T सेल्स भी रिलीज होंगे, एंड इट इज़ द करेक्टरिस्टिक फीचर ऑफ इन्फेक्शियस मोनोन्यूक्लियोसिस. देयर विल बी मैलिग्नेंट ट्रांसफॉर्मेशन ऑफ बीटा सेल एंड फाइनली ऑन्कोजेनिसिटी. Clinical manifestations are headache, fever, malaise, pharyngitis, cervical lymphadenopathy, hepatosplenomegaly, rashes following ampicillin therapy, atypical lymphocytosis, and autoantibody reactive to sheep RBC antigen. Specific test is Paul Bunel's test and treatment is acyclovir and rituximab. Next is adenovirus, which is non-enveloped DNA virus and space vehicle shape. Clinical manifestations are upper respiratory tract infection in children, pneumonia, acute respiratory distress syndrome, swimming pool conjunctivitis, which is PCF, pharyngoconjunctival fever, epidemic keratoconjunctivitis, which is shipyard eye, infantile gastroenteritis, acute hemorrhagic cystitis, affect immunocompromised patient and transplant recipients. Treatment is symptomatic treatment and it is also used for gene therapy. Next is Acinetobacter, which is caused by Acinetobacter baumannii, Acinetobacter chalcoaceticus and Acinetobacter lophi. So it is spread by multi-drug resistance and unhygienic hospital practice. So obviously अब unhygienic hospital practice है तो hospital acquired infection cause करेगा like VAP, COTY and CLABSI. And it can also cause post-neurosurgical meningitis, wound and soft tissue infection and infection in burns patient. So it is obligate anaerobe and it will show non-hemolytic colony on blood agar and lactose non-fermenting colony with faint pink tint on McConkey agar, and it is gram-negative cocobacilli. Treatment is guided by susceptibility reports. Next is Milioidosis, which is Burkholderia caused by Burkholderia pseudomeli. So it is saprophyte of soil and water transmitted through inoculation, inhalation, aspiration, ingestion. It is the most virulent and risk factors are diabetes, rainy season, renal failure or traumatic inoculation, and occurs mainly in rice farmers. So it is Vietnam time bomb disease and also called great mimicker. Clinical features are acute localized infection, mild bronchitis, TB like pneumonia, acute bloodstream infection or chronic suppurative infection. It can also cause bioterrorism, bipolar or safety pin appearance show करेगा, and ash down medium is used for culture. Treatment is ceftazidime or carbapenem. Next is Burkholderia malayi, which is a pathogen of horse. So it causes glanders and farcy. Glanders is nasal discharge and ulcer in nasal septum, and farcy is skin lesion and lymph node involvement. So it is a zoonotic disease, non-motile and oxidase negative. Features are local skin nodules will be there, lymphadenitis, pneumonia, sepsis and ulceration of trachea. Treatment is again carbapenem, ceftazidime. Now is Burkholderia cepacia complex. There are 18 closely related genomic species, and it is environmental organism that inhabit moist environment, detergent and IV fluid. So mainly environment में मिल जाएगा. So it is a plant pathogen that causes onion rot. Virulence factor are Cabel-Pilus, elastase and LPS, lipopolysaccharide. Clinical feature are cepacia syndrome. Means rapidly fatal respiratory infection and septicemia in patient with cystic fibrosis. It is nosocomial pathogen and treatment is cotrimoxazole, meropenem, doxycycline and levofloxacin. So next is Elizabeth Kingia, which is caused by Elizabeth Kingia meningosepticum. It can cause neonatal meningitis, pneumonia, sepsis, endocarditis, bacteremia and soft tissue infection. So it is a gram-negative bacillus which is treated by fluoroquinolones. Then is Stentotrophomonas, which is a saprophyte found in rhizosphere, and it is favored by immunocompromised patient. Means immunocompromised patients को affect करेगा, and patients जो broad spectrum antibiotic ले रहे हैं. So it is hospital acquired and treatment is cotrimoxazole, levofloxacin and minocycline. नेक्स्ट मोस्ट इम्पॉर्टेंट इज इन्फ्लुएंजा, जिसके 4 जेनेरा होंगे. इन्फ्लुएंजा ए, बी, सी एंड डी. इन्फ्लुएंजा ए में 18 एच सब टाइप्स होंगे एंड 11 एन सब टाइप्स होंगे. बी का कोई सब टाइप नहीं होगा. सी इज डिटेक्टेड लेस फ्रीक्वेंटली, बहुत कम डिटेक्ट होता है. एंड डी विल इन्फेक्ट द कैटल. इट विल शो हेलिकल सिमेट्री. वायरल प्रोटीन्स में 2 नॉन स्ट्रक्चरल प्रोटीन्स हैं, NS1 NS2 मीन्स नॉन स्ट्रक्चरल, एंड 8 स्ट्रक्चरल प्रोटीन्स है, PB1 PB2 PA NP HA NA M1 एंड M2. सो एंटीजेनिक वेरिएशंस अगर देखें, विच इज़ द मोस्ट इम्पॉर्टेंट थिंग हेयर. सो 2 तरह की वेरिएशंस दिखाएगा, एंटीजेनिक ड्रिफ्ट एंड एंटीजेनिक शिफ्ट. एंटीजेनिक ड्रिफ्ट इज माइनर चेंज due to point mutation in HANA gene. Occur in both influenza A and B. There is alteration in amino acid sequence and virus can easily escape host immune system, and this drift will occur every 2-3 years. So next is antigenic shift, which is major and drastic changes. Occur due to genetic resortment between 2 or more genome of influenza virus and occur only in influenza A. तो ड्रिफ्ट A और B दोनों में होगा और शिफ्ट सिर्फ A में होगा. So this influenza is transmitted through inhalation of respiratory droplets via contact with surface of fomites. Pathogenesis is that viral HA will attach to sialic acid receptor on respiratory mucosa. वहाँ पे वो वायरस रेप्लिकेट करेगा. It will infect daughter virions, which will spread to adjacent respiratory epithelial cells and further to lower respiratory tract and then to bloodstream and extrapulmonary sites. और वहाँ जाके वो सेलुलर डिस्ट्रक्शन करेगा और म्यूकोजा का डिस्क्वामेशन कर देगा. क्लिनिकल मैनिफेस्टेशन इज फ्लू सिंड्रोम दिखाएगा विच इज़ अनकॉम्प्लिकेटेड इन्फ्लुएंजा, जिसमें चिल्स होंगे, हेडेक, ड्राई कफ, फीवर, माइल्जिया, एनोरेक्सिया. देन न्यूमोनिया, COPD, ओटाइटिस मीडिया, पैरोटाइटिस, एस्थमा, रेस सिंड्रोम, मायोसाइटिस, रेब्डोमायोलाइसिस, myocarditis and encephalitis, and they will be post influenza Guillain-Barré syndrome. अब एक पैंडमिक आता है यहाँ पे, इन्फ्लुएंजा ए H1N1 PDM09 पैंडमिक कैलिफोर्निया में आया था इन March 2009. देयर इज जेनेटिक रीअसॉर्टमेंट ऑफ 4 strains which is 4 human strain, 2 swine strain and 1 avian strain. So it occurred in pigs and it is called reassortment of 4 strains, and it is transmitted from human to human. क्लिनिकल फीचर्स इसके क्या आते हैं? अनकॉम्प्लिकेटेड इन्फ्लुएंजा, एंड कॉम्प्लिकेटेड इन्फ्लुएंजा में वी हैव सेकेंडरी बैक्टीरियल न्यूमोनिया, CNS इन्वॉल्वमेंट, डिहाइड्रेशन एंड मल्टी ऑर्गन फेलियर. तो अब इन्फ्लुएंजा को हम कैटेगराइज कैसे करेंगे? कैटेगरी A, B एंड C. सो कैटेगरी A में वी हैव इन्फ्लुएंजा लाइक इलनेस, माइल्ड फीवर, कफ, सोर थ्रॉट, बॉडी एक हो भी सकता है, नहीं भी हो सकता, मे और मे नॉट, हेडेक, डायरिया एंड वोमिटिंग. कैटेगरी बी में कंप्लीट कैटेगरी ए प्लस हाई ग्रेड फीवर, सीवियर सोर थ्रॉट और एनी अदर रिस्क फैक्टर. एंड कैटेगरी सी में वी हैव SARS विच इज सिवियर एक्यूट रेस्पिरेटरी सिंड्रोम. सो कैटेगरी B +1 will worsening of chronic condition, red flag sign in children, inability to feedback, convulsion and breathlessness, chest pain, fall in BP, blood in sputum and bluish discoloration of the nails. And treatment can be zanamivir, oseltamivir, peramivir and amantadine. How to prevent it? Strict hand hygiene, isolated room, cough etiquette should be there and PPE kits must be used. वैक्सीन इन्फ्लुएंजा की 2 वैक्सीन है, इंजेक्टेबल एंड लाइव एट्यूनेटेड. नेक्स्ट इज RSV, रेस्पिरेटरी सिंक्टियल वायरस. इट इज़ द मोस्ट कॉमन कॉज ऑफ लोअर रेस्पिरेटरी डिसीज ट्रांसमिटेड बाय डायरेक्ट कॉन्टैक्ट और लार्ज ड्रॉपलेट इनहेलेशन. क्लिनिकल मैनिफेस्टेशन इज लोअर रेस्पिरेटरी ट्रैक इन्फेक्शन, रनिंग नोज, फीवर, कफ, wheezing and dyspnea. X-ray will reveal peribronchial thickening, lobar consolidation and diffuse interstitial infiltration. Parainfluenza is major cause of lower respiratory tract infection. Type 1 and 3 are respirovirus and type 2, 4A, 4E are rubella virus genus. Transmitted by respiratory route. Clinical feature are mild common cold syndrome, croup, pneumonia, bronchitis and otitis media. Then there are influenza like upper respiratory symptom and recurrent infection. Treatment is ribavirin. Thank you.